So, as far as we have studied about the techniques of exercise therapy, now we will focus on the posture, right? So, according to you, what is posture? See, posture is nothing but you can say the state of the body, right? The in which it is present. For example, like I am at rest, right? Or whenever I started the movement, the state of the body in the movement as well as in the rest, that state of body is called your posture, right? So, posture is a state of body. And if we talk about the active movement and posture, then what is that? It is nothing. See, you know what is posture now, right? And active movement is the posture which involves your active muscular contraction. The posture which involves your active muscular contraction, that is your active movement and posture. For example, let's say I told one patient to lift his arm, right? So, to lift his arm, he'll contract his muscle and the body is in some state of position. So, that state of position in the active movement is called your active movement and posture. Correct? All right. And then if we talk about the passive movement and posture, it is again the same, means the state of position of the body, that is your posture. And passive movement is means your body is at rest, your muscle will not contract, right? Your muscle will not contract, or it is not able to contract, or you are not contracting it by on purpose, right? So there can be many situations. Let's discuss. See, either your body is at rest, or your body doesn't allow to move, means you are not in a condition to move, then you will be at rest only, right? For example, in the case of the stroke, half of the body is paralyzed, so the patient is not able to move his body voluntarily if he wants also, right? Then there is also a passive movement will be performed, right? So that state of position in which your passive movement is performed, that is your passive movement and posture, because body is in the state of position, that is your posture, right? Or your body doesn't allow you to move. So we have the two conditions, either your body doesn't allow you to move, or you are not moving with your wish, right? Means you are relaxing, right? Or you want some support to move. Then in both the conditions, your passive movement and posture is means your posture is will be in your passive movement. And if you are doing something or you are moving, then it involves your active movement. So the posture which is gained in that movement, that is called your active movement and posture. Correct? All right. Now if I talk about the techniques for treatment, right? Now, if I talk about the techniques of the treatment that are effective, then what are the techniques that are effective according to you? What are the techniques that are effective according to you? See, if I have to give the treatment, right, then I have to adopt some techniques. And for adopting the techniques, I should use some method, right? So the methods are, means you assume some exercise or you prescribe that exercises in which the exercise or in which your movement should be maximum, means your activity should required which is to be maximum. Okay, that technique should be adopted. So the first movement is, or first technique is, in which activity required to be maximum, right? And if we talk about the second technique, then what we can say or what we can assume, means you select that patterns of movement which are already known to the patient. how the patient is knowing the patterns of the movement? Means you involve the activities or you prescribe that exercises in which the patient is doing his everyday life activities, right? Means for example, from waking up, okay, or dressing, bathing, whatever, from ADLs to whatever the activities which are involved in the patient's daily life, right? You prescribe the exercises or you design the patterns in such a way that it resembles the patient's normal daily life activities. All right, then it would be maximum that patient will use that, and it will be in a functional way. Means if the patient is doing that exercises, then it will help the patient to perform him in the functional in a better functional way, right? Means by doing that exercises the patient can improve, or he can, or he or she can do better in his activities, right? So prescribe the patterns of movement which are known to the patient. How it will be known to the patient? Means which are used in the daily activities of the patient. Now I'll give you one example. For example, you take the patient of the stroke, right? And if he is not able to move, and once you achieve some movement, okay, or we can say he has only paresis, not paralysis. Means some movement is preserved. Then we made him do the exercises and improve his grade, right? Once his grade is improved, then prescribe him the exercises or prescribe her the exercises that which are known to her or him. For example, the patient is homemaker, right? And you prescribe the exercises or you do the exercises in such a manner that the most of the time, for example, her is spent in the kitchen, right? So you design the exercises in such a way that you have to take one bar and put it on the shelf, and again you have to take it and open it. Means it will involve his activities also, her activities also, her hands also, means movements are involved. Along with that, her activities will be improved in a functional way. Means once the patient has gained the control on the exercises, he or she has not to do the same thing to or she has not to do the extra things to gain and perform better in his functional life. Means because you are designing the exercises in such a way that it will help him or her in her functional routine also, right? So these only I am telling you patterns of movement prescribe in such a fashion that the patient is that are helpful to the patient in his functional routine also, right? Okay, so these are the techniques. So now, as far as the techniques are concerned, so I told you the patterns of the movement are, or the techniques are to be prescribed in such a way that maximum activity should be required, right? So how would you achieve the maximum contraction? So how would you achieve the maximum contraction? See, I have already discussed in my previous video. If you don't know, just go to that video, right? See, means to maximum contract the muscle. To contract the muscle maximally, its maximal motor unit should be contracted, right? You know that there is a one motor unit which are which are supplying to the number of fibers of one muscle, right? So there are many motor units or many neurons which are supplying to the many muscle fibers of the one muscle, right? So if I told you to contract the muscle maximally, means your all the motor units should be contracted, then only you will get the maximal contraction, right? Means for example, see here, if it is a one neuron, it's another neuron, it's another neuron, and I'm drawing it very roughly, right? So these are the nerve endings. So they are supplying to the different muscle fibers of one muscle. For example, this is a muscle, right? So these are supplying to the different muscle fibers. Now here, if I want to contract the muscle maximally, right? So here, if I have to contract the muscle maximally, so these all the motor units has to be contract, right? Or these all the motor units has to be supplied, and they should be contract simultaneously. If they are contracting simultaneously, then only we can achieve the maximal contraction of the muscle. You are getting my point? Means, for example, if only this motor unit is contracting, the now muscle fibers are contracting not fully, na, means only few muscle fibers will be contract, and you will not gain the maximal contraction. So to gain the maximal contraction, you have to need to contract all the motor units, so that you all the muscle fibers are contracted and you gain the maximal contraction of the muscle. Got it? And now if I told you, for example, I have to increase the strength of the patient, right? Increase the strength of the patient. And we take the example, here we take the example of the patient A, right? Of the name A, who has grade 3. Let's talk about the biceps only, right? Who has the grade 3 in his biceps. So to increase the contraction or to increase the strength of the biceps of the patient, right? What we have to do? What we have to do to increase the strength of the patient? I already told you techniques of exercise therapy that we follow, that assisted, then free exercises, then assisted resisted, then resisted, right? So here the patient is able to perform. So in which category he is? In which category he is? He is in the free exercises types, right? Means he is able to perform the exercises, so he is in the range of free exercises form, right? So if I have to increase the strength of the patient here, means I have to bring the patient's grade 4 to 5 from 3, right? From 3 I have to bring the grade of the muscle to 4 to 5. So what I have to do? I have to increase the strength, and for increasing the strength I have to provide the resistance to the patient. So resistance is directly proportional to the strength. Means whatever the resistance according to the patient's requirement. Means if the patient is able to hold only 3 kgs and I am providing him with the 10 kgs, he will unable to hold it, or the muscle injury will be occur, right? So according to the grade, see, if the patient is able to carry the weight of 3 kgs, you can extend it to the 5 kgs, okay, not more than that. Means if you are increasing the resistance, right, then if he is performing the exercises in that resistance, then the strength will also be increased, right? So resistance is directly proportional to the strength, uh, but keep in mind that resistance should be given accordingly, right? So means, do if you have to increase the strength of the patient, if you have to increase the strength of the patient, then you provide the resistance, okay, that is externally provided. If you provide the resistance to the patient, and in the that resistance patient is doing the exercises, then the strength will be obviously increased, okay. Now let's proceed to the next thing. See, for example, for example, I have to do the lengthening of the patient's muscle. See, now for example, my biceps is stiff, right, and I have to lengthen it. So to lengthening the muscle, I'll contract the opposite muscle. You know, we have talked about the group action of muscles, right? If you don't know, just go to my that video and check it there. See, we have the agonist, antagonist, and your fixators and synergists. These are your group action of the muscle. If I talk about the agonist, right? If I talk about the agonist, for example, in the case of biceps, agonist is your biceps and antagonist is your triceps, right? For an agonist to contract, antagonist will relax, then only the movement will occur, right? So here if I have to lengthen the biceps, means I have to do the lengthening in the biceps because the biceps is stiff. What I will do? I will contract the antagonist. For see, if antagonists are contracting, right? If antagonists are contracting, obviously the biceps will be relaxed, or they have to contract in the lengthening way. Means they are not contracting, they are lengthening. They are doing its function by lengthening and controlling the triceps, right? They take the opposite action. Means if I contract the triceps, then triceps will be your agonist and biceps will be your antagonist, right? So the lengthening of the muscle will be occur in this fashion. Clear? So now if I talk about the patterns of the mass movement, which we have already discussed, but I'll tell you in the detail. See, I told you give the patient the exercises or the patterns of the movement which are known to the patient, right? See, I have also given you the example. See, for example, the patient is, let's say, homemaker, right? So you prescribe the exercises to the patient in such a way that he or she was doing in earlier, right? So his brain is knowing or is aware of that activities, right? And if we prescribe these exercises only, right, it will help the patient, or we will or it will give the advantage, it will advantage to the give advantage to the therapist as well as to the patient. Means patient knows the movement. Now therapist is not concerned about making the patient learn that movement, right? And if the patient is doing the movement, therapist only has to assist that if he is not able to do, because if the patient is putting his effort and the therapist is giving the direction only, or just taking the or giving the support so that the patient can perform the movement, and in that way we also get the movement or the muscles which are to be trained in that functional movement only, right? For example, see, for example, let's say, let's take the example of, you tell me anything. Let's take the example of office employee, right? He used to work at the office, and his work is, what is his work? To bring the files, right? Let's suppose to bring the files. So we will prescribe him the exercises in such a way that he has to carry some weight and put it on the table, and from that table he has to pick up all the files or the weights and shift it in onto the another table, right? So what it helps that we give the patient that patterns of mass movement only which are earlier known to the patient, right? And we will help him as, for example, he is picking up the files and putting it on the another table and doing it vice versa, right? So the muscles to be trained are trained in that functional movement only. Means we do not have to train the muscle first that which is injured, then again we have to put it him or put him in the functional way. Means then we have to do the double work, right? So to avoid that, we give him the patterns of the movement or involve the patient in that pattern of movement which are known to him, and we will provide just the support to the patient so that he can or she can able to do it and train the muscles in that function only, right? If we train the muscle in that function only, then we don't have to train it again and again, right? Means we are getting the muscle training also and we are getting the activity also. Means purpose is also solved and the injury is also solved, right? So now I'll tell you one situation. See, if the activity is not possible or patient is not able to do anything, right? For example, I told you in the hospitalized condition or in the stroke case, if the patient is unable to do anything, then or in the case of frozen shoulder also you can take, right? For example, patient is taking the movement only up to 90 degree because of the pain or fear of the pain, patient is not able to move or is not moving his or her arm above 90 degree. So what the therapist do, therapist has to perform the passive movement there in order to gain the range of motion. Means range of motion will not be hampered due to the fear of the pain or due to the lack of inactivity or due to the any reason. Means wherever the movement is not possible voluntarily or actively, there the passive movement is performed so that the range of motion is to be maintained. And also we are giving the forced passive movement. Here you can take the example of again frozen shoulder, right? Means patient will not allow you to move above the 90 degree because of the pain. But you will see the limits, right? You will see the limits, and according to that, the therapist will push the movement or take the limb passively upwards so that it will not allow or it will not hamper the range of motion. So there we give the forced passive movement also, right? Means it will help you to gain the range of motion, right? And also prevent the adhesions contractures, means to avoid the complications, the passive movement is used there, right? So now if I talk about the approach to the patient's problem. See, we approach to the patient's problem very differently. Why? Because each patient has the different problem. There is no is no situation that the problem or there is no one problem which is faced by all the patients. Okay. For example, there is one patient who has the case of frozen shoulder, and there is another patient who has a case of OA knees. Let's take another example also. For example, patient is having the cervical spondylosis. Range of problems, I mean to say PIVD, right? So these problems are different for every individual. Means this is patient A, patient B, patient C, patient D. Means you will have to approach the problem to the patient differently. Means if there is a case of the frozen shoulder, you can't take that approach only to the ONs, or you can't take that approach only to the cervical spondylosis or the PIVD, right? Means for every problem you have to approach it differently, right? Because every patient is different and the problem is also different for every patient, so your approach should be also be different, right? These are the cases where the means where the problems are different, right? Then you have to change your approach accordingly to the condition of the patient. And now if I talk about the patient A and B, right? There are two patients who has the same problem. Let's suppose frozen shoulder only, right? Means these are the two different individuals who are having the frozen shoulder only, but here also you have to approach differently for these two patients, right? Means although they have the frozen shoulder, but I think means according to me the problems can be different. Means some patient has a problem to in some range, or some patient has a problem in another range, or they require the in the functional training they require the different treatments, right? Means they have the different problems. So we approach the patient, or we approach to the patient's problem differently. Means every patient or every individual is different, so we have to treat him or approach him with a different approach, right? Clear? So to do that we need to assess the patient, right? We need to assess the patient. we have to make the detailed assessment of the patient, that what is the condition, what are the requirements of the patient, and how we have to approach to the treatment, how the patient is responding to the treatment. So when the patient is responding to the treatment, means if you are giving the one session, it should be giving some of the relief, right? If there is no relief, if there is no relief to the patient in sessions, then there is no, means your either your treatment is not correct, or you should stop that treatment, because it is not gaining anything to the patient, right? Means it is not giving any advantage to the patient, right? So to approach to the patient's problem, we require the detailed assessment of the patient. So, if we assess the patient, right, what do we ask to the patient? Means assessment of the patient condition. What is the condition of the patient? We'll see according to, with the some tests, right? We will diagnose it, and we will see the condition. What is the condition and what is to be do in that, right? That is our plan. And we'll ask the patient some questions, that what is the patient's need to do. Means, for example, if the patient is having some problem, right, or a patient approaches to you with some let's say strain or anything. For example, if the patient is now the hemiplegic, and after that he is only the sole breadwinner, right, he has to return to his activity so that he can run his family. So we need to prioritize the patient's activity. Means what is important to the patient right now, means why he has come to us, to get rid of which problems, right? So we need to do we need to focus on the prioritization of the patient, which means what things we need to cover first, so that patient can get rid of that activities, right? And what patient can do. Now here we will focus that what are the abilities of the patient. For example, patient comes to you with the, here we will talk about the hemiplegia, right, and the strain. We'll see one by one. Let's talk about first hemiplegia. So here we will after he came to us, we will focus him, and we will check that there is a hemiplegia, and then we will focus that what is the need of the patient, means what he has to do, means what are the functional training or the daily activities in which he needs to be independent, or what is to be done, or what is to be trained first, so that he can go to his activity in which he was earlier, right? Means he can run his family financially, right? So we will prioritize that activities and help him to be independent in that activities, right? And then we will if we have prioritized that activities, then we will see the abilities of the patient. Means right now what are the things which are available, or which are the muscles which are available, or which are stronger, right? So that we can focus on that, we can, means we can reinforce that, or we can make the muscles strengthen which are still available to us, means which are still stronger, right? And we will make the muscles more stronger, so that it can take the function of your weaker muscles, right? So that it can take the function of your weaker muscles, and also can help you to do that function, right? So to that so to see that, we check the abilities of the patient, and then we will see the inabilities of the patient, that what patient is unable to do, means what are the activities that patient is not able to perform now, and we can focus on that, and we can work on it, and then we will see that either we can bring that activity, then we will work on it, right? So these are the approach to the patient. Means we will take the detailed assessment of the patient, and then we will focus that what are the needs of the patient, what are the abilities, and what are the disabilities. According to that, we can focus on the area of the treatment, or we can plan our treatment, right? And if we see the example of the strain, means patient is having your ankle sprain, right? And he comes to us. For example, we talk about the sprain, ankle sprain, and he comes to us. See, due to the ankle sprain, he has got the swelling and pain. So, the first focus of the patient is to get rid of the pain, because due to the pain, his activities are hampering. His daily life is not means his daily life is obstructing, right? And he is not able to perform his activities fruitfully in the daily life due to the pain, right? So we will focus on first the pain, that we have to make the patient get out of this pain, right? And then we will see the abilities of the patient, means earlier his ankle was in which position, or now means after the injury how much activity is possible in his ankle, right, after removing the pain. And we will also focus that in which position the patient is not able to perform the movements, right? And then we will plan our treatment accordingly, that what we have to bring and which are the muscles which are still which are still has the grade 3 or means a better grade, then we will strengthen that muscles. And which are the muscles which have the very less grade and we need to improve that, means we have to focus or assess that activities, then only we can plan our treatment, right, accordingly. So in order to assess these activities, right, we need or we require some test. In order to assess these activities we require some test, right? So now we will discuss the methods of testing, means what are the tests that we have to perform so that we are able to know that in which area patient is suffering the problem, or what is the problem which is suffered by the patient, right? So we will focus on the methods of testing, right?